Hello, my dear students. Let's start section 34.2, reproductive processes. After talking about the reproductive anatomy and talking about the reproductive systems, let's talk about the reproductive processes. There are different reproductive processes in male and female. What makes these processes different? Different organs and different hormones. So those reproductive processes are regulated by hormones. They depend on hormones. Let's talk about the reproductive processes in female. Number one, the formation of eggs in female. This is called oogenesis. Oogenesis is the formation of egg. It starts before birth. And which step starts before birth? Only mitosis to form the primary oocyte, which is 2N. After birth and during puberty, meiosis 1 will take place. Meiosis 1 to form the secondary oocyte. When does meiosis 2 occur, and when is it completed? It's completed only after fertilization, after marriage, after fertilization, completion of meiosis 2. This is the process of oogenesis. And the egg, as you know, the egg is haploid or diploid. The egg is haploid. It contains 23 chromosomes. And after meiosis, the formation of only one egg. Here, after meiosis 1, this one is polar body, will be disintegrated. After meiosis 2, formation also of only one egg. What are the hormones that catalyze the cycles in females? FSH and LH. FSH is called follicle stimulating hormone. LH is called luteinizing hormone. Both are secreted from anterior pituitary gland in the brain. Anterior pituitary gland. In this figure, it shows this is the uterus, fallopian tube. This is the ovary. The ovary contains the egg. After releasing of the egg will be received by fallopian tubes to move inside to meet the sperm. If there is no sperm, it will fall down without fertilization. This is the ovary. Here it is. The cycle in female is called menstrual cycle, which occurs each month. The first phase in menstrual cycle, follicular phase. This is the phase after menstruation. If I want to count days, I can start by the period or bleeding. This is the menstrual cycle, the menstruation. After menstruation, formation of the follicle and maturation of follicles. This is follicular phase, maturation of follicles. In the follicular phase, maturation of follicles, what are follicles? Are several tiny cavities in ovaries. They secrete estrogen. What tells those follicles to mature? A hormone called FSH hormone that's secreted from the pituitary gland, anterior pituitary gland. So what stimulates follicular phase, or what starts follicular phase? FSH, and at the end of FSH, at the end of follicular phase, an increase in the estrogen level. After that, after maturation of the follicle, rupturing of the follicle to release the egg out of the ovary, to release the egg here. As you see, releasing of the egg. This is the ovulation process. After releasing of egg, the remaining part from the follicle is called corpus luteum. This corpus luteum will stay in the ovary and will increase the secretion of progesterone and estrogen. Actually, progesterone and estrogen will lead to increasing the thickness of the endometrium, the lining of the uterus. Look here, this is the thickness of endometrium. This during the spilling out of the lining. during menstruation. Here in the follicular phase, gradual increase till the maximum increase during the luteal phase. After the release of the egg is ready for fertilization, and also the endometrium is ready for implanting the embryo, waiting for the fertilized egg to be implanted there. What if there is no implantation? What will happen? We will know. But first, let's know what stimulates ovulation. What stimulates this process? The release of egg. The LH hormone, luteinizing hormone, will be secreted from the anterior pituitary gland to stimulate the secondary oocyte to rupture out of the ovary. What stimulates ovulation? LH. What stimulates the follicular phase? FSH. What if there is no fertilization after ovulation? This is the luteal phase. After ovulation, the corpus luteum, as I told you, will increase the thickness of the endometrium and increasing in the progesterone and estrogen level. What if there is no implantation of the embryo? The building of the lining of the uterus breaks down and is shed. There are some tissues and some blood are discharged from the vagina, and this bleeding is commonly called the period. This is the menstruation. Number 1, this is menstruation. After menstruation, follicular phase, ovulation, luteal phase, and again menstruation. When does the menstrual cycle stops? It stops at menopause. Menopause. The age of menopause is different from one woman to the other, but cycle continues until a woman's age 14 to 15 years old. What happens during menopause? Decline in the level of hormones that will lead to irregular cycles, after that stopping of the cycle. Thank you for your listening.